My name is Dr. Michael Karlfeldt. I'm a naturopathic doctor. I've been in practice for 25 years. Hypothyroidism is a big issue that a lot of people are dealing with. It's causing fatigue, people are dealing with depression, causing excessive weight, people can lose hair. A common issue is that you start to lose this little hair in your eyebrow right over here. So there are a lot of, and the skin can be dry, so there's a lot of these symptoms that are connected to hypothyroidism. As a naturopathic doctor, there are a lot of different natural substances that you can use to support a healthy, functioning thyroid. You can use things like selenium, iodine, certain other types of minerals. You have lithium. You have a lot of different herbs that are very supportive for the thyroid. Also, something that is crucial when you're dealing with thyroid, what I see frequently, is that because we're exposed to a lot of chemicals, it actually interferes with the function of the thyroid, so it actually gets inflamed and it gets exhausted, and then it just starts to shut down, and it's not able to produce the amount of hormones that it needs to produce. Also, another issue is actually chlorine. You have the production of things like T3, T4. The number 3 and the number 4 is the iodine component. And when you're exposed to things like chlorine, fluorine, all of that actually pushes the iodine out of the system. So it actually interferes with the production of the thyroid. And also, I have a lot of patients that come to me, and when they have all the symptoms of hypothyroidism, but they go to a medical doctor and they do a blood test and everything looks fine, that actually doesn't mean much. What I liken it to is kind of like you have two offices. One office that is, it's easily is able to produce all the end product that it needs, and then another office has to work really hard and is really stressed and exhausted, but is able to produce the same amount of end product. So it's kind of like that when you're looking in the blood. It may look, you have two different individuals. Thyroid is working perfect, the other one's thyroid is exhausted, but the blood levels may look exactly the same. The difference is that in one scenario, the thyroid is under no stress, and the other scenario, the thyroid is about to collapse, and the person is dealing with all these hypothyroid symptoms, but they go to a medical doctor and they say, well, your thyroid looks fine. So when you come to me, I will then put together a nutritional protocol that will help you to restore and regenerate your proper thyroid function.